Hi, I'm Dr. Matt Schnault, and let me share with you the most common causes and the most effective therapies to help with spinal arthritis. Now, spinal arthritis all starts with a couple of different ways. Number one is could be a major trauma. Okay. Number two, major trauma actually could be could be automobile accidents. Number two is the repetitive traumas over years, usually with spinal arthritis. Now, the most common symptoms of spinal arthritis is a decrease in range of motion, especially at the end motions when you kind of notice you're turning and all of a sudden you have pain, or bending over to pick up your child or the grandchild, all of a sudden you start noticing you have pain. It's that end motion with spinal arthritis you notice the most. You can get a dull, achy pain. Some spinal arthritis, you can even get sharp pains and muscle spasms and even some burning. Now, the most effective therapies that I've noticed with spinal arthritis is number one, chiropractic, number two, clinical massage, and number three is rehab. Now, what chiropractic is, it's a form of physical medicine where we help identify the area, we help mobilize that area, and we help that with three different ways. Okay, number one, we help identify the nerve irritation, the pinched nerve. Okay, number two, the joint irritation, especially with spinal arthritis. There's a lot of joint irritation. And number three is disc bulges. Okay. Now, what clinical massage does and how it helps with spinal arthritis is it's going to help with the muscle spasms, the muscle tension. The trigger points that now are forming because of the arthritis. Now, what our licensed massage therapists are going to do is they're going to come up and help massage that area, help with the trigger points and that muscle tension. Now, how our rehab department, what it's going to do is it's going to help strengthen the certain areas, but really more importantly, it's going to help stretch those areas that are affected by the spinal arthritis. Now, in summary, how these therapies help with spinal arthritis are different in three different ways. Number one is increasing your range of motion, which is very important because in spinal arthritis, we definitely have a decrease of range of motion. And a lot of times within the first visit, we're already noticing, obviously, a decrease in pain. Number two is a decrease in muscle pain. And number three is an increase in range of motion, which is huge because with spinal arthritis, we have a lot of range of motion or motion issues. You just can't move as well. And we really help with a lot of range of motion. Now, what my patients have told me in my 14 years of experience, how we help with spinal arthritis, it helps them with, number one, is with work, okay? You know, if you have a lot of arthritis, spinal arthritis, you know what, you're not working all 8 hours without pain. You only get within about 4 hours and all of a sudden you start having pain. Number two, it helps with sleep, all right? With spinal arthritis, if you start noticing it's hard to get to sleep and it's hard to stay asleep. And number three, it's help with your daily activities. Now, if the spinal arthritis is in your neck, okay, it helps with what? Okay, shampooing your hair, blow drying your hair, getting your shirt on. If the spinal arthritis is actually in your low back, it helps get your pants on, getting in and out of the shower, bending over to tie your shoes, okay, to put your socks on. Now, hey guys, we can help with spinal arthritis. Give us a call at 664-4600.